Oh, what? Today, we're breaking down and reacting to all of these shocking medical scenes and injuries from Sniper Elite 5. Let's dive right in. Oh, what? We got a knife stab wound to the heart itself. First, think about the anatomy here. They did a really amazing, fantastic, good job. The striation of the skeletal muscle. You have the bones, but kind of silvery component over certain areas, which basically could be fascia overlying or could actually just be tendon attachments, which again, fantastic. Oh my gosh, slice to the face. We are seeing just the superficial vessels that are just kind of underneath. You have branches off of the external carotid artery that go to the temporalis muscle, across your face, sternocleidomastoid, your scalenes. There's a lot of different muscles of the neck. It's a very important structure. Is that a deadly move? No. Could cause significant amount of discomfort, pain, bleeding, but it's survivable. You can live with it, so to speak, or live to get help. Oh, stab wound to the abdomen and a slice across the neck. You can see the blood squirting. It's actually darker, it's not bright red. The reason why I say that is the jugular vein sits more superficial to the surface than your artery. The jugular vein is probably, depending on an individual and depending on your hydration status, about twice the size of the carotid, maybe even bigger. So if somebody's super dehydrated, it might be smaller because every time you take a deep breath, it actually collapses down. Oh. Intra-abdominal puncture wound. Depending on where it actually hits, obviously the different organs. So right over top of your organs is something called the omentum. And then over top of that, obviously all the muscles.
And beyond that?
On top of that, you have all the subcutaneous fat and different tissues there. You have different layers that protect, but again, it can puncture into the stomach. Could you hit the pancreas maybe? Unlikely hitting major blood vessels because they're further back. Oh my gosh. Puncture wound to the left side of the neck. Look at the major vessels going up. Impressive. You're seeing basically different branches of artery veins going up towards the head and the neck. When people describe like strokes are the ones typically they go into the deep inside to go up to the brain. And a lot of times it's due to either a abnormality relating to heartbeat, so you get turbulent flow in the heart and a clot forms and it goes up to the brain, versus you're having some atherosclerotic disease of the neck and a piece breaks off. Oh, wow. Right in the back of the head, up into the brain. The brain jiggles. It doesn't move that much. Depends on your age, actually, of how much space is inside your skull. As we get older, the brain actually shrinks a little bit and actually becomes more dense, and it gets surrounded more by cerebral spinal fluid. This allows for movement, which actually isn't the best thing in the world, because as the brain moves, it can cause ripping of your bridging veins, which can cause a subdural hematoma. Oh, the classic cervical rotation. Chiropractors won't like this one. No, I'm just kidding. The reason why that's so deadly and dangerous, disarticulating that joint high up, which then also causing issues relating to the spinal cord high up, affecting the autonomic nervous system and your basic functions. The big thing we worry about are blood vessels. You have the blood vessels going to the back that are actually protected by the bones of your spine. It cruise right through. Straight stab wound to the neck. You got your cartilage there for your airway. Your blood vessels actually run down the sides. There's a small blood vessel that runs anteriorly, but it typically shouldn't bleed that much. The reason why I'm aware of this is we do a crike, basically where we cut open the neck in an emergent situation, and sometimes it can get quite bloody because of this major blood vessel there. We're seeing blood vessels, we're seeing some bone kind of moving away, but take a look at that. You're actually seeing the bones of your vertebral column in the back, and they actually did a really good job relating to the spinous process, the transverse process. The likelihood that the bones will be flying out from a puncture wound like that, probably unlikely. The noise. How do you know that's what that sounds like? We got good anatomy. You have a lot of little vessels. I don't know if anybody's seen like Body Worlds where they have like the plasticization of the human body. If you check out the blood vessel exhibit, it's quite impressive. There's a lot of blood vessels in our bodies. Oh, stab wound to the chest. Stab wound to the head, and then we get to see the anatomy of the brain. Super cool. So you got the hemispheres. You actually see the temporal lobe. So the temporal lobe is between the cerebellum and that hemisphere. It's part of the hemisphere, the big top. But you can actually see it looks like a little bit of a horn on the side. And then you have the cerebellum, which is the balance center of the brain, on the bottom. Oi. They decide to show us the back. The skin of the back is super thick, and even the subcutaneous tissue is really, really thick. But we're seeing here that it's like a cage, right? The rib cage. And so they actually attach, all those ribs attach to your vertebral column. The scapula are gone. We don't see them here. Where this person is stabbed, left upper back, could be into like your left kidney or the lower part of your lung. Wow. So a lot of blood trauma, blunt force. If you fracture a rib with a lot of force, it could actually puncture the lung. You get a pneumothorax or a hemothorax. Hemothorax meaning blood into the chest cavity. Pneumothorax meaning that there's air into the chest cavity in spaces where it shouldn't be. Oh, chokehold. Depending on the pressure, how much blood flow and airway compression, and how fast and hard it happens, people can get knocked out in just a few seconds. I've actually even seen it with my own 2 eyes. Once you stop and you allow blood flow to reflow again, the likelihood that there's any permanent damage is pretty low. But if you continue to hold this type of move, that's when permanent damage can occur. Because there's a fixed object where everything else is not moving, could you have disarticulated the joints in the neck, causing a severance of the spinal cord? Possibly. We call these basically internal decapitations. See, are they breathing? Do they have a pulse? All the normal basic things that you'd see, and check if you have somebody who's unresponsive. Ow! Knife goes to the medial aspect of the right knee. I'm just telling you, hitting a bone is really hard to slice through. Probably getting soft tissue like posterior or anterior to the bone, or it's actually hitting the bone and getting stuck. You can slice the tendons of your hamstrings. Oh, stab wound to the right trapezius neck area. I know a lot of people come to the emergency department with like headaches, neck pain. It's all related to this trapezius muscle that attaches to the base of the skull, goes to your shoulder, and then down the mid part of your back. Anybody seen that old school wrestler Goldberg? He had like the biggest traps ever, the trapezius muscles. Oh, blast injuries. That's probably not survivable. You're that close. Rupture your lungs, rupture your eardrums. You might be blown into pieces because of the force, so unlikely anything good coming from that. I don't think this person's coming to see me in the emergency department unless the angle is from a great height and going straight down on that side. So if it's all frontal in the face, this is survivable as long as the brain tissue is still intact. So if it's just facial trauma, it could eventually be repaired. They did a good job, good graphics, good movements. There's takedowns. Also, I made fast-acting health supplements with you in mind. No matter what the issue, I got you covered. Check out Life Happens. You take them only when you need them. If you guys enjoyed this, definitely check out these other videos right here, binge watch everything. And please make sure you subscribe, turn your bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.